Have you ever heard of someone using cannabis and then getting hit with waves of intense nausea and vomiting, finding their only relief in scorching hot showers? It might sound strange, but this is a real and increasingly common condition called Cannabinoid Hyperemesis Syndrome, or CHS. And today we're going to break down exactly what it is, why it happens, and what you need to know about it. So what is CHS? Essentially, it's a condition that can develop in some long-term frequent cannabis users. Hyperemesis literally means severe vomiting. After years of regular use, the body's reaction to cannabinoids, like THC and CBD, can flip. Instead of easing nausea, cannabis starts to cause it, along with severe abdominal pain and uncontrollable vomiting. It's a paradoxical effect that can be incredibly distressing and even dangerous if left untreated, leading to serious complications like severe dehydration. One of the most unique and telling signs of CHS is the compulsive need to take hot baths or showers. For reasons we're still figuring out, hot water provides temporary relief from the intense nausea and stomach pain. People with CHS might spend hours a day in the bathroom, desperate for any comfort. If you hear about someone who can't stop vomiting but feels better in a hot shower, CHS should be on the radar. So how common is this? It's tough to get exact numbers because many people don't connect their symptoms to their cannabis use, or they're reluctant to talk about it with a doctor. However, with cannabis becoming more potent and widely available, emergency rooms are seeing more and more cases. One study found that nearly a third of frequent cannabis users who went to the emergency department for vomiting actually met the criteria for CHS. This isn't just a rare side effect, it's a significant health concern. The symptoms of CHS typically unfold in 3 phases. First is the prodromal phase. This can last for months or even years. You might feel a bit nauseous in the mornings, have some vague belly discomfort, and maybe a fear of throwing up, but you don't actually get sick. Many people in this phase might even use more cannabis, thinking it will help their nausea, without realizing it's the underlying cause. Then comes the hyperemetic phase. This is the acute, intense part of the syndrome. It's marked by overwhelming, repeated episodes of vomiting, sometimes as often as 5 times an hour. The abdominal pain can be severe, and this is when that strange craving for hot showers really kicks in. Some people even experience what's been nicknamed scromiting, a combination of screaming and vomiting, because the pain is just that intense. This phase can last for 24 to 48 hours and often leads to an emergency room visit. Finally, there's the recovery phase. This phase begins when you stop using cannabis. The symptoms don't vanish overnight. It can take a few days or even weeks for the nausea and vomiting to subside completely. But once you've been off cannabis for a while, the symptoms disappear, and you start to feel like yourself again. So what's actually happening in the body to cause this? Scientists believe it's linked to the long-term overstimulation of the body's endocannabinoid system. This system has receptors all over, including your brain and your gut, and it helps regulate things like mood, appetite, and, you guessed it, nausea and vomiting. The theory is that after years of being bombarded by cannabinoids from cannabis, these receptors get thrown out of whack. The system that's supposed to control nausea goes into overdrive, causing the exact opposite effect. Who is at risk? CHS typically affects people who have been using cannabis regularly, often daily, for many years, sometimes a decade or more. It's more common in adults who started using in their teens. But here's the tricky part. Not everyone who uses cannabis long-term will get CHS. We still don't know why some people are susceptible while others aren't. It highlights that everyone's body chemistry is different and can react in unexpected ways. Getting a diagnosis can be a challenge. When a patient comes to the emergency department with severe vomiting, doctors will run a bunch of tests to rule out other serious conditions. They'll do blood work, check for infections, and maybe even do imaging like a CT scan. The key to diagnosing CHS is the patient's history. That's why it is so crucial to be completely honest with your healthcare provider about your cannabis use. How often, how much, and for how long. When they hear about long-term use combined with cyclic vomiting and the unique detail about hot showers providing relief, the puzzle pieces start to fit. Without this information, it's often misdiagnosed as something else. Now for the most important part, treatment. During an acute hyperemetic attack, the main goal in the hospital is to manage the symptoms and prevent complications. This means IV fluids to combat dehydration, medications to try and ease the nausea, though standard anti-nausea drugs often don't work very well for CHS, and sometimes pain relief. Some reports suggest that applying capsaicin cream, the stuff that makes chili peppers hot, to the abdomen can help by distracting the pain receptors, but all of these are just temporary fixes. They don't solve the underlying problem. The only known definitive cure for cannabinoid hyperemesis syndrome is to completely stop using cannabis. All forms of it, no exceptions. Even a small amount can trigger a relapse and send you right back into that awful cycle of vomiting. Quitting can be incredibly difficult, especially if you've been using for a long time. The good news is that after stopping, most people feel significant relief within a week or two, though it can take a few months to feel fully recovered. If you're struggling to quit, please know that help is available. Talk to your doctor, a therapist, or an addiction counselor. There are resources and support systems out there designed to help you through this process. You don't have to do it alone. CHS is a serious condition that can have some pretty nasty complications if ignored, from tooth decay and esophageal tears due to vomiting, to severe dehydration and electrolyte imbalances that can be life-threatening. It's a powerful reminder that even natural substances can have complex and sometimes harmful effects on our bodies. If anything we've talked about today sounds familiar to you or someone you know, please take it seriously and seek medical advice. Please share this video to people you know who might be interested to know about this content. Thank you so much for watching and taking the time to learn about this important topic. If you found this video helpful, please give it a thumbs up, comment, and consider subscribing for more health and wellness content. This video is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult a healthcare professional regarding any questions or concerns about your health or cannabis use. Stay safe, stay informed, and we'll see you in the next video.